what can PRP, PRF, and exosomes be used for? Start like from the top of the head down. What kind of stuff can you use it for?
So we, um, you know, everything actually, what can't it be used for? But main thing, let's start at the top, hair regrowth.
Mhm.
People that have either suffered from alopecia or they've had a big, huge stress or a trauma, and they've caused them to lose their hair. PRP is great for that. PRF is 10 times better, and exosomes mixed with it just is a whole new chia pet, right?
Right.
So hair regrowth,
And one of the things we talked about also from hair regrowth is that there's a lot to be said about some of the preparatory stuff that people are doing to get an even better response, like oxygen. It's almost like
yes,
oxygen therapy.
yes,
Right.
exactly,
Mm.
yes. And so, if you combine that and you start in you want your hair regrowth, psoriasis, skin conditions. We're all concerned about our, surface of our, of our skin, and as we age, we get brown spots and stuff like that. So we use it for topicals, before lasers, before microneedling,
So
even
these little
just to
brown
apply.
damaged spots that we can get on our skin from shaving vigorously and then going tanning, you literally can apply
Yes,
this directly. Your own stuff, your own body
yes,
can produce something
yes,
that can potentially repair that compared to going for these anti-browning creams that people
yes,
usually go where all you're doing is blocking
chemically based, right,
tyrosinase, right? So this way you're not.
right. Yep.
So we're talking about something natural again. So okay, skin, hair.
Here.
What else can we see?
Um, I'm not from the dental world, but I know that they are using it like crazy for bone grafting and implants and all kinds of gum
Mhm.
repair. So that's awesome.
What
The
about for where as we're getting older and all of our smiles have finally started creating these nice maps in our skin, which we call
Yes,
wrinkles?
yes,
Does it help in that regard?
absolutely, absolutely. You can put it in the nasolabial folds. That's this big heavy thing. You can build up someone's cheek, and you put it in there. It's very malleable. It's wonderful, and it helps them grow that collagen back that we've lost. So replenish, so fullness, texture, um, neck. Everybody hates their neck. Injection techniques into the neck helps with the skin. So and then it just gives you a youthful look, helps rejuvenate your skin.
Mhm.
You move from there, lots of places, there for a long time, butt implants, breast implants, and then we did FAMI, but now they're using your own biofill to do your butt augs and your breast augs. um,
Really, can you get that much? Can you get? Obviously, that would take a lot of sessions, right? Depending on
right,
what
it's
someone's looking
yeah,
to accomplish.
yeah. And again, it's realistic expectations,
Mhm.
but if you want something natural in to enhance yourself, then that's absolutely the way to go. And myself personally, I know that I would much rather use something of myself to improve myself than have to do something else. So you can get augmentation with it. um we use it on the skin of the arms, the texture, scars. Can definitely help with scarring, acne scarring. Of course, I can't say enough
Is
about
that topical when you're doing it with acne scarring, or are you actually injecting at the base?
a little bit of both. A
Okay.
little bit of both. We recommend some kind of micro needling to also help penetrate it, and then recommend going in and then doing some injections as well, because it just both topically, and it's a different different depths. Um, so we use that all over the body, scars everywhere, um, joints, sexual wellness. I'm very passionate about the sexual wellness.
I actually
Um,
want to do that in detail in
okay,
minutes because you would think, what is a functional cardiologist? Why am I dealing with PRF and PRP? But one of the biggest side effects that we always deal with in the cardiology realm, especially when you're prescribing conventional prescriptions, is erectile dysfunction. And then we have women that are basically going to be going through menopause. And you would think that, well, what does that have to do with your cardiovascular? It has a lot to do with it, honestly. But we're also from a woman's perspective, there's a series of problems that are getting created when you go through menopause from a genital urinary perspective.
yes.
So between bladder incontinence, just not feeling well, dryness when people are having sex. So these kinds
Intercourse.
of things are things that do impact your health in an indirect way. From a cardiac perspective, obviously, having sex is healthy for you. So,
Absolutely.
and if you're taking that piece of your life away, it can definitely impact your health in general. So,
Well, and then it leads to mental issues too,
of course, of
you
course. So,
know, I
yeah, why
mean,
don't we talk about the sexual wellness aspect of things? You can actually use this for sexual wellness in which way?
several ways,
Mhm.
several ways. And I'm always I'm passionate about it. Of course, I'm happy that everybody gets an enhanced pleasure out of it. That's just kind of a given. It's more circulation both for the men and women. So right off the bat, they're gonna see, enhanced sexual pleasure, enhanced orgasms. That's great. For the what do we do for all of us people as we're aging aspect of it, especially women, incontinence is huge. If you've had vaginal deliveries, I think every woman knows as we age with menopause, we get dry, not as tight. It's painful to have intercourse, lichen planus sclerosis, leakage. So, if you tear it down to that, it's wonderful. It can help, of course, with pleasure, but it's injected into an area around the urethra that helps to repair the urethra. So from the time, just age and babies and all the things that we go through, mesh used to be our only option. This is wonderful. From personal experience to the millions of women that we have this discussion and we teach just a sexual wellness, class every 6 weeks. Um, where they can actually talk about their feelings and tell us. And there's something we can actually do. It's from their blood, make it, spin it, inject it, and give them relief from painful intercourse, give them relief from lichen planus sclerosis, give them relief from incontinence, and help them. Some women as we age, where it's so painful, even to entertain intercourse is not great, and that's hard mentally. It is, like you said, it's healthy for your body. And then you have your partners, and is it me, is it them, what's going on? Same for women as is with men. Men, have erectile dysfunction typically as they get older, or they have Peyronie's, or they have, inconsistent bladder, peeing streams. And we go in and we teach people to inject and use their own blood, their bio PRF, their biofill, their PRP with exosomes, and it gives circulation, helps to get feeling back. Um, and so, it's a wellness, and it's a part of our lives that people don't like to talk about, and it's kind of a hush hush um, thing. But I think if you got everybody in a room, we'd all start telling you, oh God, I have this, I have that, I hate this, I hate that, and whatever happened to my morning hard on, or I mean, or even just sensation and blood flow, for the men too. So it's become a standard in
Well,
treating for that.
the urinary incontinence part, even for men, sort of surprises me, but not really, because we're even giving men now Cialis 5 milligrams every day for the purposes of trying to improve that urinary control, that sense of having to go to urinate. And lo
Yes,
and behold, you can use something of your own body. You'll probably have to go through 3 sessions, and that
exactly.
could be something that could be gone for an extended period of time without having to rely
Exactly.
on medications at all. Um,
Well,
and I think the other thing is we're talking about the things from a genital urinary perspective in terms of how you feel, how you urinate, but also anatomically you can make a difference too, right? So
yes,
tell us a little more
exactly.
about that. Yeah.
Exactly. So for the men, obviously the injections help for all the things we just discussed, but they also get a benefit of about a half inch of girth and length.
Wow.
Um,
Okay.
which is kind of nice. And some can get more depending, but we always say roughly about a half inch to an inch. For the women, we can fluff back up the labia, and as we get older, and the color, it helps with the color, it helps with the texture, it helps fill it back up and makes it youthful. And as we age, you look in the mirror one day and you're like, oh, wow, okay, and then we do it, and you look back down and you're like, wow, that is kind of pretty again. It just makes you feel good about yourself.
So does it change the feeling for women at all if you change the
Absolutely.
anatomy on the
Yes.
outside? So does it make
Yes.
it more comfortable to have sex essentially?
More comfortable,
Mhm.
just, I mean, women don't talk about it. You get sores down there as you get older, and rubbing, and your skin gets thinner, and there's just a lot of things that happen, and so it helps rejuvenate that, so you can feel better. You can go on your runs. You can play with your kids. You can enjoy intercourse again. You can feel healthier down there. You're not as dry. So yeah, it's amazing.
So we recently did a weekend at our place on Long Island, and the results on the people that came in were pretty stellar. And I'm talking about within 12 to 24 hours, and that blew my mind. I've never seen anything give those kinds of favorable results in such a short period of time, and men and women, by the way,
Yeah,
not
absolutely.
just women, but in both,
Right.
and so fast. And yet, so you think that it would take maybe 2 or 3 treatments? Like how? What's the average amount of treatments to get sustained
So,
effects?
so here's how I say
Mhm.
this. If they're younger and you're starting maintenance or just starting, most of those people get their one treatment. You recommend three, and they're like, "Yeah, I'll see you in a couple years." They're so happy, it's great. They just don't come back. I mean, it would be wonderful if they did, because remember, you're building for the future and helping longevity. But most of them are so excited, they are like, "That was awesome," whatever. Then
Mhm.
as we get older, and maybe the problem has progressed a little bit more, then two treatments for sure. And then if there is somebody who I would say it definitely has a functioning issue, like a high, like, okay, I've got bad lichen scarring of the vagina,
Mhm.
um, you know, they're going to need their three treatments. So we recommend that they get three treatments about 4 to 6 weeks apart, and then kind of give it time, reassess in about 4 to 6 months. If they feel like I'm doing great, great. If they want more, they can have more. You can never do too much of your own, which is
Right.
nice.
Mhm.
But it's, yeah, I mean, usually they see such wonderful results right off the bat. They're like, "Oh, that was great," and then they don't
So
always come
that
right
was
back.
another thing that I noticed, even with some of the people that we spoke to in the office, is that some people have tried PRP in the past, or they've even tried PRF that comes from plant
Right,
sources,
sources,
and
exactly.
they go, try that doesn't work. That stuff doesn't work. And yet, when they got the real deal, it was a big difference.
It was a big difference, and it is hard. I mean, there's all kinds of sources out there, but like you said, plant derived, made, but your own is the best.
Mhm.
And the thing I think people also don't realize is, you get it, they get a nice immediate result. They don't realize that the body's rebuilding for about a 4 month to 6 month period. So even if they love it here, it's only getting better, because it's, it is as wonderful as it is and miraculous that it is that you enjoy it immediately. It's the long term you're really going for.
Right,
So it's like the beginning is great, but you'll get people to come back 4 months later and they're like, "Oh my gosh, you weren't kidding. I mean, my skin even looks better. My,
right.
sexual wellness is enhanced," that type of
Yeah, so
thing.
I want to make sure I didn't misspeak about this, but the PRP and the PRF obviously is coming from your own blood, but it's the
Right,
exosomes that people are out there selling plant-derived exosomes, which makes no sense. That's not even human,
right.
honestly. And you could try to make it as close to human, but you can't mimic what God's done in terms of what kind of growth factors you're going to have there, what kind of mesenchymal stem cells you're going to be harvesting. So that's a complete. But you had told me something interesting about using exosomes in the sexual wellness realm, and that
Yes,
it could be pretty powerful to the point where some people say, okay, that's too much. Eh,
exactly.
Can you tell us a
Exactly.
little bit about that history or,
Yeah, and I mean, for a lack of anybody, I'm older. I'm over 50. Personal plus many of the women. But I definitely was having issues from dryness to sensation to pain, to I have an orgasm, that's great, that was wonderful. And I've done the PRP first, and again, it would hit and miss. The PRF was amazing, and then one time I decided I'm going to add exosomes to it and just see. And it has been an eye opener, and I would say that there's no way you could get me in a good way to have another set of exosomes for probably a year or two, or when I need it, because it's so powerful now, that it's so intense. Bless my partner's life, but the orgasms don't stop. Let's put it that way. So
that's amazing. And there's so many
honestly,
people, yeah, there's so many people in the world that really have problems with this.
yeah,
And yet there's a fix out there that's readily available. It's just impressive to me, really.
yes.
Um, Yeah.
And I too, just I had incontinence and I had had a rectal prolapse
Mhm.
with my deliveries, and had done everything. And I actually, between the exosomes and the PRF, the rectal prolapse has completely corrected itself. And that's been 10 years of dealing with it. And the urinary incontinence, I would probably urinate 5 or 6 times a night, and now I go maybe once during the night. Otherwise, I make it all night. And same thing, I'm no longer, when I'm teaching or training, going, I gotta go, I'll be right back. And I can tell you that all the women and men, pretty much say the same thing.
Mhm.
So, but to the extent of, yeah, it can get almost too powerful. Like, then you got to go
That's
to work,
impressive.
right? You got to leave your bedroom.
Yeah, listen, from my perspective and the perspective of our practice, we always want to go as close to natural, as close to just causing your own healing and your
Absolutely.
own balancing. I think those are the best things that we could possibly do for people. Um, and um, and I don't think there's enough practitioners out there showing people that this is possible, that it doesn't take a prescription medication to achieve wellness, whether it's in the sexual realm or cardiovascular realm. Honestly, even though exosomes are slightly outside of that realm, they're very powerful.
They're
Um,
very,
and I'm very excited about the cardiac line that's going to be coming down. And so I'm going to be looking forward to that, because there's plenty of people with heart failure out there, or people that have recalcitrant angina and the kind of atherosclerotic
absolutely,
problems that need
absolutely.
help. And I think exosomes are going to hold a lot of promise, as stem cells did at one point in time.
Yeah,
But you're not going to have that restriction to use exosomes the way stem cells
right,
are restricted,
right.
and you have a better idea about the source. But when it comes to PRF, I think that's a complete no-brainer for so many different problems that we see in the office. So
I,
yeah.
we train and teach and can, encourage all of the practices. It can go everywhere. I mean,
Mm.
there's just nowhere. I mean, why wouldn't you, right? Even the ophthalmologists are like using it and making eye drops out of it because it's so, it's amazing for the
That's great. That makes a lot of sense, because you could use it topically.